Hello students, welcome to Gyanvyar School of Education, Suresh Gyanvyar University. I'm Dr. Sonia Kaur Bansal and today I will be teaching you the topic behavioral disorders in children in the subject psychology of teaching and learning. Students, this is a very important topic for the prospective teachers as they will be understanding what are the behavioral disorders in children and how to tackle with them. So my learning objectives and index is as following on your screen. So first of all, we will see introduction. Then we will define what are the behavioral problems and the causes of behavioral problems and disorders. Then you will also be able to understand the types of behavioral disorders among children. Assessment of common behavioral disorders will also be understood by you during this lecture, and you will also be able to comprehend the description of behavioral disorders. And in conclusion, we will see what we have studied in during this lecture. All right, students, so let's study about the behavioral disorders among children. Now, students, it's very important for everyone to understand that what are the behavioral disorders. So, behavior is certainly a word that we all understand, but disorder is something that is not positive. And when someone says disorders, so we get the imagination of being unorganized and not a very happy state. So, it is including many tensions, reducing the activities of the children in normal span, what they do during their classroom activities or homely activities or whatever the work they do in their childhood at various level of development. So we have already discussed in earlier lectures also that students go through PMSC like physical, mental, social and emotional development during childhood or adolescence. But this is the stage where they are facing lots of inner or outer problems also. So some of these habit develop from adults through imitation, whereas other as purposeful movement. So what are the behavioral disorders and how it is going to affect their studies? It is very important for all of you to understand it, because until unless you are understanding their behavioral disorders, you are not sure that you are going to teach them in a proper way. Because teaching is where there is a teaching, that certainly be learning also, but learning is a great challenging task. So let's understand it in a more elaborative way, students. So what do we understand by behavioral disorder? So it's very important to know for all of us that when child cannot adjust to a complex environment, whatever is around them or him, they become unable to behave in a socially acceptable way. And it results in exhibition of peculiar behaviors. And this is called as behavioral problems. So the basic thing that you have to understand that normal behavior is not seen in such children, and they are actually showing some behavioral characteristics that is not acceptable by the society. So this is how behavioral changes are into actually some sort of problems. All right, students, so let's understand the causes of behavioral disorders. Why do children behave in a certain unorganized way, or why they feel so insecure, or why it is like that? So we have to understand that students actually learners learn when they find the proper environment. But if the environment is failing to give them what they require, so this results into behavioral problems or disorders. So we have to understand, students, that all young children can be naughty, they can be defiant and impulsive from time to time, which is perfectly normal. So what is abnormal about it? So something is there. So however, some children have extremely difficult and challenging behaviors that the outside the norm of their age. They are not behaving according to their age, or maybe their IQ level is low by that time. So the most common disruptive behavior disorders include oppositional defiant disorders, that we call ODD, conduct disorder, CD, and attention deficit hyperactivity disorder, that is ADHD. So these behavioral disorders, well, I will be defining you, but first of all, you just understand what are the causes of behavioral disorders. That's really very important for everyone to understand who is aspiring to become a teacher specifically, that what is actually there in the surroundings of children that is making them behaving in a improper way. So when we are talking about disorders, so child psychology experts from the University of Oxford and University of Pittsburgh say that the term disorder should be used cautiously for the children up to 5 years old and questions its validity. So many professors say that the evidence is limited, that the problems in preschool indicate problems later in life also. So that behavioral issues are evidence of a true disorder. So there are concerns about distinguishing normal from abnormal behavior in this period of rapid development change. All right, students. So this is how why the behavioral disorders occur. So why there is so much problem in that? So let's understand what are the behavioral and emotional problems we will understanding. But first of all, understand what are the causes of behavioral changes. So first of all, faulty parental attitude. The child shows behavioral disorders. Why the child is showing that behavioral disorders? That has to be understood by the parents, and it is really very important for from the side of the parents that they must understand if they are having two kids or two more than two kids, then their attitude, either it is positive or negative towards the little things of the child, that matters a lot. So sometimes parents expect so much, parents are expecting so much, and then the child is actually carrying the weight of those expectations, and that becomes the main cause of behavioral disorders. The child shows some frustration through his behavior and he's not able to cope up with that. All right, students, maybe the parents are loving more to one child and not the another child, and maybe the appreciation is there, and maybe the comparison is there all the time to for the another child. So these are some factors which seems to be very light in nature, or maybe it's a not very serious kind, but they impact really very hard on child's behavior. So this is one of the cause of behavioral disorder. Then secondly, we can say inadequate family environment. Yes, this is very important to understand that the family environment affects the whole personality of the child. How the both parent behave with each other, are they fighting, are they living lovingly with each other? The child is observant at this time, and the child is observing everything. So when the child is observing very positive, cool, loving environment in the family, so the child is trying to show the same with his environment, either in his school or with friends. So he is going to show the same things. But on the contrary, if the family environment is not adequate, the parents are fighting all the time, or the parents are separated due to some reasons, so that situation becomes very challenging for the child's behavior. How to shape up that personality and behavior of the children when the parents are separated, or any other issue in the family, or maybe some of the family members are really very strict kind of showing strict kind of behavior, and the child is not able to absorb that. So this is how family environment is really very important. It should be positive, cool, and very cooperative. So the basic values are actually the child is inheriting or observing from the parents only. All right, students, I hope you are understanding this point. And then next point is mentally and physically sick or handicapped conditions. This is really a very challenging condition. If the child is mentally sick, is slow learner, or some sort of mental problems are there in learning. So maybe the child is physically sick or handicapped conditions. Child is more and more dependent on other persons of the family. So this will cause definitely the behavioral disorders in the child's personality. So next cause we can understand that influence of social relationship. What kind of social relationship the parents are having with the neighbors or relatives or anyone else, family, friends. So this influences the child's behavior also. The child gets the message that okay, we must also do the same thing with others as my parents are doing. So social relationship is the main cause of the behavioral disorders. There are two ways: either it is completely corrected or it is completely disordered. So it is really influencing factor in child's behavioral disorders. The next cause we can see that influence of mass media. So multimedia, mass media, they play an important role. Maybe the child is following some actor or actress, and some particular kind of behavior he has seen in the movies, or some kind of viral messages are there that is affecting him to great length. So these will be adopted. If the negative thing is there, the child is adopting, then definitely some sort of behavioral disorders are possible that the child will show. Then influence of social change. So what kind of social change is around in the environment? Are the people really changing their views about some certain kinds of rituals, traditions, behaviors, or people? So this will also change the behavior of the child, or maybe it is like the child is not adjusting with the new changes. So it's really very important to understand that the child is having lots of influence of social change on him. Now let's understand students' types of behavioral problems, and it's really very important for all of you to understand it very attentively, because these behavioral problems you will or you might see in your classrooms also, or you might see in your family children also. So behavioral disorders results due to deprivation in any one of the area mentioned below. It's really very necessary for all the children to be happy in all the areas like physical, emotional, social, and other forms. And as we have discussed earlier, if any of the area is not fulfilled, needs are not fulfilled, just remember the Maslow's needs I have discussed earlier. So if this need is not fulfilled, then behavioral problem is definitely about to occur. So just remember there, if there is emotional deprivation, physical deprivation, social deprivation, or other forms, then definitely the child is going to show some behavioral problems. So these are the types of behavioral problems we are going to understand in detail. Now, first of all, emotional deprivation. Emotional deprivation occurs when a child is continuously criticized by the parents, by the teachers, by the siblings, by the relatives, or by the friends. So it can be this can be done by anyone, but what it is leading to, that I'm going to tell you. So the child is criticized and neglected and ignored or abused by primary caregiver when we are talking about the small children. So behavioral problems resulting from emotional deprivation are like temper tantrums you will see, because the child will seek attention from the people who are ignoring them. So temper tantrums are a common problem in among the children. Breath holding spells is also there. The children can hold their breath for almost 1 minute, and this will lead to them faintness, and then breath holding spells, and then jealousy, insomnia, nightmares, night terrors, somnolence. So these are all the characteristics or all the deprivation characteristics of emotional part. So we have to be very careful while handling the children. Now, what is physical deprivation? So let's understand it. So physical deprived child has profound effects on developing brain. And behavioral disorders coming under this are like neurosis, like some children do bedwetting at a very uh, elder age also, incorporasis, then tics, nail biting, pica, thumb sucking. These are the characters, these are some physical deprivation sort of disorders. Then attention deficit hyperactive disorder, it is also called ADHD in clinical terms. So attention deficit hyperactive disorder is really very dangerous, and the child, if the child is showing that, then parents or caregiver must seek the solution very nicely and very immediately. Then let's talk about social deprivation. What it is? That it is the reduction of culturally normal interaction between individual and society. The child is not able to interact with other people in the society in a very normal way. So it is including like juvenile delinquency, school phobia. The child is scared of going to school. Then stealing habit may be developed. Repeated failures might be occurring. Lying is one of the biggest factor in social deprivation. And then aggressiveness, destructiveness, these are all the problems related to social deprivation. If the social deprivation is there, then these type of problems can be seen in the children. All right, students, I hope you are understanding it. Then other forms can be sibling rivalry. If the one child is not so elder and another child comes in the family, and the parents full attention goes to the newly born baby, and the other child is feeling insecure about that. So this sibling rivalry is really causing great behavioral disorder. Then speech disorder may be there, the child is not able to speak properly, so speech therapy is given for them. Now, let's understand students' assessment of common behavioral problems. How do we have to tackle that? So, how we are going to tackle the behavioral problems among the children? So, common behavioral problems must be understood, as I have told you just now. So, first of all, assess whether child is happy or difficult to manage. How can we know that the child is facing some issues or child is not happy within the environment? So this is really very causing a great challenge for the teachers as well as for the parents and other relatives or family members. So it is really how the child is going to show his behavior, and it is really clearly known by child's behavior that child is happy or not happy. So in that condition, the child is not happy. You have to see why the child is not happy, and why there are so many negative or negative attitude development in child's behavior. So this is how that you have to understand in a very good way that child's behavior is actually something that is really required a good handling. Then child's response to new situation, how the child is reacting if any new situation arises in front of him or her. So this is really very important for everyone to understand that it is important to notice child's response to new situation, how the child is behaving, how a new situation is occurring, and how the child is telling someone to do that. Then the child must be seeing that excessive demand of attention. Is there any excessive demand of children attention? That can also be a problem. So why there is so much demand of attention? Are the parents not giving equal attention to their children? So this is really very important to understand. And the problems of toilet and bladder, this is also very common thing that must be understood. So students, just try to understand that when we are actually talking about children who are having common behavioral problems, so what kind of behavior problem issues they are facing, then a habit of nail biting, thumb sucking, pica, etc. are also seen among the children. All right, students, now let's understand disorders caused by emotional deprivation. So first of all, we are going to understand, we have already understood what is emotional deprivation. And now one by one, we are going to see the disorders problems. That what is that? That I have just given you the terms now. So temper tantrum, I had discussed with you. So temper tantrum is a sudden outburst or violent display anger, frustration, and bad temper as physical aggression or resistance, such as rigid body, biting, kicking something, throwing the objects, hitting or crying, rolling on floor, screaming loudly, banging limbs, etc. So these are something that you can see from the picture also. The mother is trying to handle the child and the child is lying down on the floor, and the child is actually rigid, and he is rigid with his body, and the child is not getting up. So this is temper tantrum symptoms. Now, what can be the symptoms of temper tantrums? So, the symptoms might be the child is crying loudly, or the child is always shouting when asked something, or the child is kicking the objects of the home, or biting someone or something all the time, or head banging. Head is actually banging through against the wall or anything. Then screaming is also the another symptom of temper tantrum. Then throwing and breaking objects, inflicting self injury also. So these are some important symptoms that you must actually think when if your child is showing some these type of symptoms. All right, students, so let's understand it in a very clear way that how it should be managed. If the child is showing temper tantrums, then you must understand that it can be managed also if it has if it is given proper attention. So first of all, support the child and protect from self harm. The child should not harm himself, because it will be more dangerous then. So, and moreover, take away the child from immediate cause to, in a calm and quiet way, from whatever the situation the child is feeling. Temper tantrums are there, child is feeling restless, so just take him away from that situation immediately, and wash the face, hands of child, and change clothes. Just give him a cool soothing pampering by that time, not in a very negative way, but in a positive and peaceful way. So educating the child about acceptable behavior, and give toys and emphasize on play therapy. The play therapy plays an important role when you are actually encouraging the child to understand how behaving properly, accepting others, and acceptance of behavior is very important. So I hope you are understanding how it should be managed. Now, next thing that's very important about breath holding spells. So these are the brief periods for which young children stop breathing for at least 1 minute. Yes, and these spells often causes a child to lose consciousness among them. And it is of two types, students. First is synoptic spell, and second is pallid spell. Synoptic spell and pallid spell. Let's understand what they are. So synoptic spell is something that is caused by a change in child's usual breathing pattern, usually in response to feeling angry or frustrated. If some situation is there, the child is not feeling happy and the child is showing anger, so maybe the you can notice if the child is showing some breathing pattern changes, like the child is showing a very fast breathing, so this is cyanotic spell. You must have to have clear notice of breathing pattern. All right, then another is pallid spell. The pallid spell is about, it is caused by showing of child's heart rate, usually in response to pain, how much pain he is having and how much heart rate is going on. So the child is causing stopping his breathing at least for 1 minute. All right, I hope you have understood two types of a spell, that is cyanotic spell and pallid spell. Now, what are the signs and symptoms of controlling the breathing, or two types of spell I have told you. So these will be actually shown by fainting of the child, or maybe the stiff body, or too fast or too hard breath. So long pause before child takes another breath, red or blue purple lips, maybe the intense single or no cry at all. So these are all the signs and symptoms of holding the breath. So this is really very important and a very serious behavioral disorder that all of you must understand in a clear way. Now, what can be the management to handle this behavioral problem? So during the episode, make the child lay down in floor and prevent his or her arms or legs from hitting any sharp object. That's really very important. If the child may hit any sharp object, he may hurt himself. So after the episode, the child starts breathing immediately after 1 minute. But if the child does not breathe, then call emergency. All right, they give plenty of rest to the child so that child can recover its normal behavior, normal breathing pattern. Now, third important thing that has to be understood, and it's very common in nowadays children, and children show it in their peer group as well, and with siblings also. So jealousy is a normal response to actual supposed or threatened loss of affection. Why do children jealous with each other? Because they are actually fearful that I will lose the affection, I will lose the attention. That's why they are jealous. So during the birth of an additional family member, there maybe their siblings, lots of new feelings are generated in older child. Maybe his parents' love is going to be shared, things are going to be shared, grandparents are going to be shared, so everything is going to be shared now. So some kind of jealousy is there, and it's really very important to notice down the symptoms of jealousy. The child will show aggressive nature. The child will shout on many things. The roughly handling of new baby. The child might hurt the new baby by just picking him up, or what in a wrong way, or another things what he suits, or hit him in any other way that he is feeling okay. So children may act naughty to get attention by that time. So gets detached and may become over affectionate as well. So, becoming over affectionate and becoming detached is also a symptom of child's jealousy pattern behavior. All right, students. So, I hope you are understanding symptoms and now how to manage the jealousy factor among the children. So, it is really very important to manage this problem, and the important thing that must be done by the parent or the teachers, that never punish the child for his feeling of jealousy. Don't punish him. If you are going to punish him, then this problem will definitely going to increase. It is not going to be sorted out. So then teach the child to deal effectively with his emotions. How the child is going to deal effectively with his emotions. If the anger is there, how he should manage by maybe drinking water, maybe the counting pattern, or any other, playing with toy, or taking any name repeatedly. So these are some few tricks that you can manage your child's jealousy. So parents should treat child equally and avoid comparison. This is a basic reason that why jealousy arises, because the parents have started comparing the children. So professional help can also be taken in very complicated cases if the problem is not actually cured by these small management things. So professional help will definitely do some curable work. Now next is sleep disorders, and we call it somniloquy. Somniloquy is a sleep disorder that refers to talking aloud while asleep. So it can be quite loud, ranging from simple mumbling sounds to loud shouts also. The child is actually talking when the child is sleeping. So what are the symptoms? That the child is talking irregularly and giving gaps like normal conversation. So the child gives good facial expressions in sleeps also. Maybe the child is smiling, or maybe getting angry, or crying. So these are the symptoms that easily can be noticed by the parents or any family member. So you can notice that the child is suffering from sleep disorders. And how can we manage this? Sleep along with the child and assure that parents are with him or her. In that case, that doesn't mean that I'm saying that if your child is normal and there is no behavioral problem and you should just pursue him to sleep with him. No, it's not like that. Just if in case the behavioral problems are there, child is showing some symptoms of sleep disorders, then only you sleep along with the child and assure that parents and you are always with him or her. Satisfy the child's needs. What does the child need? Child is having his own needs and maybe he is not able to express it to you. So it's important for all of you to understand. So resolve conflict with other children also. If the child is having some conflicts with his friends, maybe the friends are very small and parents think they will solve it out themselves, but sometimes the parents interference is needed because the guidance is needed. So it's really very important for parents to solve the conflicts also, whatever the children are facing. Try to make good relationship with child. The child must miss you, child must love you, give proper affection. Do not show movie or tell story before sleeping. This is the worst idea that any parent can do. Rather, parents must actually talk to child about his day activity and can guide. Now, the next important behavioral disorder that we are talking about, that is somnambulism. Somnambulism, it's a phenomena of combined sleep and wakefulness. So sometimes the child is sleeping, sometimes the child is actually waking up, and in this sleep, walking occurs at a state of low consciousness. And child performs activities that are usually performed in full consciousness. So it's really very dangerous sort of behavioral disorder, and this shows the symptoms like activities like sitting up in the bed, walking in the bathroom and cleaning it in unconscious way, initiating hazardous activity like cooking, driving, grabbing hallucinated objects, homicide. So these are really very dangerous symptoms, and the parents must be really very much aware about if the child is showing this type of behavioral disorders. How can we manage it? So let's understand. Lock the door and windows of the room in which the child is sleeping. Yes, it's important, as you don't want your child to hurt from any object. Remove all dangerous and hazardous objects nearby him. Give small dose of diazepam in advanced cases. So consult a physician in uncontrollable cases also. Now, next important behavioral disorder we are going to discuss, that is nightmares and night terrors. So nightmares and night terrors in this child gets awakened due to a frightening bad dream, but the child is conscious about the surroundings. So nightmares in the child is awakened to a frightened bad dream, but the child is conscious about the surroundings in nightmares. But night terrors in this, the child gets awakened during sleep and sits up screaming and terrified to recognize the surroundings, and after some time sleeps again. All right, students, so I hope you are understanding this much. So again, I'm going to tell you the nightmares symptoms. So child suddenly awakes during sleep periods, child gets frightened and may not be fully alert as well. So child describes frightening dreams in detail. He seeks the response to comfort given by parents and may resist return to bed because of fear of recurrence. So fearful is something that child is disturbing himself from sleeping. So child is frightened all night, and in that case, how you can manage these symptoms? So give reassurance to the child by holding him that you love him and you are worried about him and you are always there with him. So speak in a very soothing tone that there is nothing wrong and everything is fine. And instead, if you are going to do another opposite thing, if you're going to shout, so just believe me, the problem is definitely going to be severe rather than it is going to be solved. So discuss the dream images with the child and work together to change the outcome as well. Then have the child to go to bed in same time every day. Yes, timings are very important, and you have to make a disciplined timetable for the child, how, when he is going to sleep or when he is going to wake up. So this is really very important. And just try to avoid scary books or movies before sleeping. If the child is watching those scary movies and books just out of excitement, then definitely it's going to disturb him during the sleep. So this is how you can manage the nightmares and night terrors. Now, next thing that we are talking about, insomnia. Insomnia in behavioral disorders is very important for you to understand, students. And it is a sleep disturbance in which children have trouble falling asleep or staying asleep at night. So insomnia is may be found in elder people also, but in child they are not able to sleep. So for the whole night they are not able to sleep. So what are the symptoms? Let's discuss. Maybe the child is feeling difficulty falling asleep, or staying asleep, or waking up too early in the morning. So being sleepy during the day, irritability is there, mood swings are there, decreased attention span is there. So being this is really very important. And even in our Indian families, the actually the elder parents are, they are always tell us that just try to make the child wake up during the daytime so that the child can sleep. So these are the normal things that we can tell the child to like control over. So this cannot be actually cleared in a good way, but you have to understand that how it is very important. So students understand that insomnia is actually something where these children are getting a good source of where the child is not feeling comfortable. So this is decreased attention span is also the causes of some sort of like important things. So students, you have to understand that these are some of the reasons that must be understood by the children and by the parents, by the teachers as well. So understand, students, that this is not only about the child's welfare, but it is the welfare of upcoming society also. So this is how students or the children, they are actually more and more important to understand about it. So I hope you are understanding, and in that way you will understand that insomnia is something when the child is asleep or waking up too early in the morning. So how can be these corrected? So management, so provide a comfortable sleep environment, set bedtime to maintain obtain usual timing of sleep, provide sleep breathing, positive mental imaginary while laying in bed, and other relaxation technique. So these are some important techniques that one must follow who is living around child. So this will really be helpful when you are handling the child in a very posing environment. And if the child is feeling comfortable and feeling loved by his elders, so child is definitely will be overcome by this problem. Now, next is masturbation and homosexuality. This is also the another behavioral disorders, and let's understand the terms. Masturbation is the simulation and manipulation of one's own genitals in order to achieve orgasm. And homosexuality is related with it is the sexual attraction between the members of same sex or gender, and it is also considered a behavioral disorder among the children. So how you are going to manage this problem? Parents should not scold or show negative attitude towards child's behavior. And advise, educate the child. So educate the child, advise and educate the child in a non-threatening way about acceptable behaviors in public. So, as intellectual development progress, incidents of masturbation declines in preschoolers. So, this is really very important for the parents and teachers to handle, and moreover, parents are more responsible for this. Now, bruxism, though both are correct in pronunciation, it is excessive grinding or clenching of teeth while sleeping, so which is not related to normal function of eating or talking. So bruxism is something you can see that some children are having not proper shape of teeth, and it's some maybe they have cringed or clenched their teeth. So what are the symptoms? Let's discuss. Excessive teeth wear is there, tooth fractures are there, tooth are not proper, hypersensitive teeth may be there, grinding or tapping noise during sleep, check lip biting is also there. Tenderness, pain, or muscle fatigue is also there. Headache, particularly in temples, they are not finding it comfortable whenever they are at religious place. So this is how they are showing some types of symptoms that can be managed also, but they are showing some this behavioral disorders. So how can we manage this? Repairing the damaged teeth as soon as you can it is possible for you. Because if the child is suffering from lower confidence because of teeth, then it is also will be leading to the behavioral problems. Then dental restoration like crown filling is one of the important cure for that. So the child must feel happy for his teeth as well. So I really hope, students, that you have learned well about behavioral disorders. In my next series, I will tell you how it is very important. So in today's lecture, we have really understood about that in children are very important for everyone. Students are very important for the teachers. So parenting for childhood success is really very important. Parenting styles are rarely to blame for childhood behavioral problems. And if you are like searching out solutions to help your family cope, that's really pretty good indication that aren't causing your child's issues. So you have to see that what is causing the problem with your children. So as a teacher, as a parent, you have to be patient with the children. So empathy, a cooperative attitude, and a calm temperament, and a crucial trait for parents to adopt, as well as for the teachers to adopt as their child struggles with behavioral disorders. And it is also knowing when to ask for help is key. So, if the child's behavior becomes disruptive to the regular running of your household or their education, or if they become violent, it is time to talk to a professional. And many parents or many teachers actually do mistake for not finding the counseling or maybe professional help timely. So, raising children is really a difficult task, and with behavioral problems specifically, it's not an easy thing. But before you rush to the diagnose, you rush to something, you diagnose their problem, and just find it out what kind of specific problem. Either it is emotional deprivation, social deprivation, for what kind of problem they are suffering from. So whether your child's behavior is normal of their age or not normal, you have to find it out and provide resources to assist them. So it's really very important for everyone to understand that child shows behavioral disorders when there is definitely something lacking with them. And disorders, some children have extremely difficult and challenging behaviors that are outside the norms of their age. So these problems I have discussed emotional deprivation problems. So there are many problems like that, and boys are more likely to have these problems than girls. And it is said that boys are more likely than girls to suffer from behavioral disorders. And treatment options include parent management training, cognitive behavior therapy, medication treatment, and associated problems. So it's really very important to pay attention on their problems as well. So how you are going to see this, and how from where you are going to get the help. You can parents can be well educated for that. Family therapy can be very helpful in that. Cognitive behavioral therapy can be very helpful in that. Social training can be given. Then anger management must be taught to the children. Support for associated problems must be there. Encouragement must be given to the child, because many children do excel in academics, in other sports or cultural activities, but they are not getting any kind of encouragement from their teachers as well as from their parents. So this will result into behavioral disorders, and it will experience repeated failures in coming future. So students, just understand that these behavioral disorders are really very important to understand for all of you, because being prospective teachers, when you are understanding, when you are having clear idea about behavioral disorders of children, then only you will be having clear mind that how you are going to teach your students, and specifically how you are treating the children with behavioral disorders problems, showing the symptoms of them. So I really hope that you have enjoyed today's lecture. In continuation, I will be telling you more problems and symptoms and management of another behavioral disorders. All right, students, until then, stay safe, stay happy, and keep learning.